Yeah, I think some of the health issues faced by trans people I discussed along with the discussion on Minhua men. But some of the specific issues in relation to accessing health services I would like to discuss. So these barriers in accessing health services may happen across LGBTQ communities because they may feel the providers may not understand the sexual identity or gender identity. So they may not reveal their sexual orientation or gender identity, which may or may not have yeah, impact on the diagnosis and treatment. So, in relation to transgender people, of course, even in whether it is in public hospital or in corporate hospital, the registration procedures and the admission procedures in patient may be quite insensitive. For example, in the public hospital, whether the transgender women will be registered as a women. So that, for example, in their gender of choice, or whether some people may force them to register as a male, because nowadays, of course, even in the forms, we are supposed to include and give an option of a transgender or a third gender. Some people follow it, but that is yet to become widely. It's not yet a widely implemented practice actually, whether it is in government hospital or in private hospital. Uh, of course, the third point is the inadequate knowledge and insensitivity among healthcare providers. And of course, they may face discrimination from the healthcare providers themselves, who are supposed to take care of them in a non-judgmental way. So either their own previous experience of discrimination or anticipated discrimination, so may prevent transgender people from going to the healthcare services. It depends upon the context, because sometimes LGBT people themselves, they may not feel there is a need to. For example, if I go just for a fever, I may think it's only a viral fever, it's a cough. So there is no, for example, I may think there's no need to then disclose my sexual orientation to the provider. So in some situation, it may be relevant. For example, if I am like gay man engaging in unprotected sex in the recent past, that fever could be an indication of acute HIV infection. So in certain contexts, it may be relevant. So in certain contexts, it may not. But especially in relation to the sexual health issues, or if the person has already disclosed as a LGBTQ person, then it may be more appropriate then to explore the sexual history in detail if it seems relevant to the particular presentation of the symptoms. So otherwise, during each clinical visit, then it is not necessary or mandatory to explore the sexual history in detail, but one should be aware about the possible connections between the sexuality and gender identity and the presenting symptoms.